Hello, my name is Dr. Katherine Xie, or you can call me Dr. X. I work at the Core Institute. I'm an orthopedic surgeon specializing in foot and ankle surgery. On call, I also take care of all other common MSK injuries coming from fractures and hip fractures to even some pediatric conditions. I'm a fellowship trained in foot and ankle surgery, which means pretty much any pathology past the knee joint. That means the lower end of the leg, which is the tibia and fibula bones. That includes ankle fractures. I treat ankle conditions such as arthritis or trauma. I also treat problems like bunions, which are commonly afflicting very many people and affect many people in their daily lives. I was always very fascinated by science and mechanics. I was a biomedical engineering college, and I really loved how engineering and biology combines to sort of create new technologies and make differences in people's lives. And so in medical school, fell in love with orthopedic surgery, never looked back after first year. And I was also a ballroom dancer in college, which meant that, to me, the foot and ankle seemed like really precise pieces of machinery that, when working properly, can do amazing things. My patient experiences show that with the right surgery, the right treatment, the right rehab, and collaboration between all the different team members, we can truly create a lot of differences in patients' lives. I think the most important thing about foot and ankle is that you use your feet every day. You gotta walk, you gotta get up and do things. And everybody has different demands on their life based on their feet. So my ethos is that I want to have a shared goal with the patient. So what can you expect when you first time you see me? I think that one of the most important things for me is that to treat each patient individually, meaning patient A is different than patient B, even if it's the same condition or the same injury. So a lot of times I'll spend a lot of time talking not only about the injury, but also about what your life is like, what you want to get back to, what are your conditions, what are your concerns and questions, because I think every patient is different. I want to treat you as an individual. I do have a memorable patient story. This happened when I was in training, but it was a man who was very active, who unfortunately suffered terrible bilateral lower extremity injuries. I remember seeing him for the first time in the ICU, and I promised him, hey, I don't know what's going to happen, but you're here now. We're going to give you the best care that we can do, and with you together, we are going to see what we can get you back to. 10 months later, he has finished all the different complex reconstructive surgeries of his legs, and he actually climbed a tree for the first time. At the end of the day, that's what matters, is that this man was so afraid in one of the most scariest moments of his life, and we were able to help him get back to doing climbing trees, which is what he loved. What makes really Core Institute is so unique is that we have so many different subspecialties, not only within orthopedics, but also neurosurgery, neurology, interventional pain. Because at the end of the day, an MSK pathology is not just a bone, even though I think it's the most important. There's muscles, there's nerves, there's a patient on top of that, and they have an interdisciplinary team, including even interventional pain, as well as physical therapy in-house, tricked together, truly makes a difference. It makes the care for the patient easier as well, because they know that we can talk to each other, the colleagues are very congenial, and we communicate all the time.